So today we'll be looking at Thiazide Diuretics. These drugs inhibit sodium reabsorption at the distal convolutal tube. They act within 1 or 2 hours of oral administration, and duration of action is 12 to 24 hours. Therefore, should be taken in the day and night. It should be taken in the day and not at night, as it will disturb your sleep. So what are the available drugs? Hydrochlorothiazide, which is usually called as HCT, indapamide and metolazone. Indications of the thiazide diuretic is they used to treat high blood pressure and congestive heart failure, as well as the accumulation of fluid and swelling of the body caused by conditions such as heart failure, cirrhosis, chronic disease, kidney failure, corticosteroid medications and nephrotic syndrome. What are the cautions? Pregnancy, breastfeeding, diabetes. So what are the side effects? Hyperkalemia, hyponatremia, hypertension, then hyperseremia, hyperglycemia, hyperlipidemia, hypertensitivity and renal impairment. So these were the side effects. What are the contraindications? Dehydration, severe hyperkalemia. HCT is the drug. So this group, the thiazide diuretic group, the main drug is HCT. So HCT is the main drug of this group. So indapamide does not increase blood glucose, but others increase. Now before taking hydrochlorothiazide, you should always make sure hydrochlorothiazide is safe for you. So if you have any allergy or anything, if you're unable to pass urine, then you should tell your doctor before this. And also you should keep in mind to tell your doctor if you have a history of a kidney disease, liver disease, glaucoma, low levels of potassium or sodium in your blood, high levels of calcium in your blood, or diabetes, and also allergies to penicillin. So hydrochlorothiazide is not expected to be harmful. It is actually harmful to an unborn baby. So however, if you take this medicine during pregnancy, your newborn baby will develop into jaundice or any other problems. So tell your doctor if you're planning to get pregnant or if you're pregnant. Then hydrochloride can pass into your breastfeeding, like to the baby. So if you're actually breastfeeding, you shouldn't take hydrochlorothiazide. This medicine is not approved for whoever is younger than 18 years old. How should you take hydrochlorothiazide? Take exactly like your doctor has prescribed you. Follow all the direction on your prescription label. So hydrochlorothiazide is usually taken once per day. So you should always follow your doctor's instructions very carefully. If you have a feeling of vomitish or diarrhea, or you're sweating more than usual, you should make sure you tell your doctor, because this can lead to low blood pressure or a serious electrolyte imbalance. So while using hydrochlorothiazide, there would be many blood pressure checkups. So if your blood and urine both may be tested if you have been vomiting or dehydrated. What happens if you miss a dose? Don't think this is like the other drugs. So if you miss a dose of this, you should take the missed dose, as you soon remember, and keep the missed dose if it is almost time for your next scheduled dose. Do not take extra medicine to make the missed up dose. So what you should do, if to avoid, what you should do, like when you are taking hydrochlorothiazide, what you should avoid, you should always avoid drinking alcohol with this medicine because it can cause severe side effects. So hydrochlorothiazide has some side effects as well. So side effects are eye pain, vision problems, jaundice, pale skin, shortness of breath, signs of electrolyte imbalance, severe skin reaction, common hydrochlorides. So those are the ones which usually happen. So it can be sometimes the common ones are the nausea, diarrhea, muscle spasm or dizziness. So don't mix up. Before I told you all, like previous one was for the thiazide diuretic, but now which I told you all the side effects is for HCT. What are the other drugs? As in, what are the contraindications while you're taking HCT? So it is insulin or other pressure medications, steroid medicines or NSAIDs. So I hope, don't forget to share, subscribe and like this video if you liked it and if you found it useful. Thank you so much and wait for my next video.